This is Angelica Perez, your iVoice Latina here in New York. I'm here in Washington Heights in front of Dr. Yager's Aesthetics, a place where 95% of the patients are Latina women. We're going to have a chat with Dr. Yager and one of his patients about plastic surgery, Latinas, and services.
Well, when I was in my training at Columbia Presbyterian Hospital, which is diagonally across the street from where we are right now, in the late 80s, I noticed that when I was in the hospital, I was the only plastic surgeon that spoke Spanish. And the patients in the community are Dominican mainly, but highly Hispanic population. And every week we'd see in the emergency room some patients with infected wounds or problems or complications from cosmetic surgeries performed overseas. The reasons why they went overseas weren't always financial. Some of them are respected professionals in their fields that's not trying to do things on the cheap. The reasons they gave were very interesting. Some people came because they felt that they looked different than everybody else in the waiting room in the doctor's office on Park Avenue. They felt intimidated by the locations on the east side. They felt that their English wasn't good enough or they didn't speak English at all, and to have somebody, a nurse or an assistant or somebody, translate, they didn't know if they were really communicating well with the doctor. And when you're talking about aesthetics, you really have to communicate well to know what the patient's looking for.
During my visit at Dr. Yager's clinic, I had the opportunity to interview and speak to a patient, a 30-year-old Dominican woman who had had plastic surgery in the Dominican Republic 8 years ago. This patient, who was willing to share her story, was not willing to show her face. She still struggles with issues of shame from an experience that no one should go through.
I decided to go to the Dominican Republic because I knew a few friends who actually went there, and they were happy and they looked really good. I had a tummy tuck.
A tummy tuck?
Mm-hmm. After surgery, I will have to follow up every week with the doctor. So after my second to third week, I noticed a very pale area on my lower stomach. It was right in the middle. So I went to the doctor and showed it to him, and he said that was dead skin. Mm. They had to cut it off. No anesthesia or anything. They just cut it off. It didn't hurt because it was just dead. And I stayed in for one more week in the hospital with them, and they were taking care of they were curing it. They asked for me to never look at it because they don't want me to get depressed or anything like that. So I didn't. But when it was time to go home, I did. What I found was a huge hole. It was big, and it was deep too. And I didn't eat or talk for that whole day. So I waited at least 7 years, 6 years, 7 years now. Mm-hmm. And I was researching. So I found Dr. Yager, so I came to him. When it's time for surgery, it's not time to save money. It's time to get a doctor who will ask for a reasonable price for you to get the results that you want.
When I asked her what she would advise someone who's interested or contemplating getting plastic surgery, Carmen emphasized the importance of doing research, doing your homework, asking questions, and meeting with patients who have had similar procedures.